Hey guys, welcome back to my channel. My name is Sarah. To be honest with you, I wasn't sure if I wanted to be filming this video at all, because I'm sure you'll agree with me is that we have been completely oversaturated with information about the coronavirus pandemic from world-leading experts, and I didn't want to film a video unless I was sure I had something more to add. But over the last couple of weeks I have been receiving some questions relating to COVID-19, so I thought I would try to answer these questions in a short video. Okay, so the very first question, should the public be wearing masks to reduce the spread of COVID-19? So we started off the video with a question that has very conflicting answers. The World Health Organization and Public Health England have both released statements to say that the general public do not need to be wearing masks outside of the home for a number of reasons. One is that masks give a false sense of reassurance and that people should be focusing on other methods to reduce the spread of infection, for example, hand hygiene and physical distancing. And the other reason being is that obviously if everyone is using a mask, then there might be a shortage of supply and resources to healthcare professionals. However, other governments and other agencies have a different point of view on this. For example, in Singapore, it is mandatory for everyone to wear a mask outside of the home, and people actually face penalties for not wearing a mask. For example, in the first instance, if you're caught without a mask, you have to pay a $300 fine, and then if you're caught again, you have to pay a $1,000 fine. Now, my thoughts on all of this is that you should take a common sense approach to wearing masks. For example, if you live in a remote village and you don't have contact with a lot of people, you really do not need to be wearing a mask, so please don't wear one. But if, for example, you're in a public transport, you're on a bus or a train, it's a very confined space, it's very difficult to maintain that physical distance of 2 meters, then yes, at that point, please do wear a mask. And what the mask will do, it won't protect you from sort of getting the infection, but it might help reduce the transmission of infectious droplets from person to person. Okay, question 2. How do we test for coronavirus? In the UK, we test for coronavirus with swab testing. So swabs look like long cotton earbuds. They're inserted into the back of the nose and the back of the mouth. Then they're sent off to the lab where they run a test called polymerase chain reaction to identify any genetic material of the virus. The government has promised to run about 100,000 tests a day, but in the UK we are achieving somewhere in the region of 15 to 20,000 tests a day. The government also wants us to be doing antibody testing. Antibody testing, essentially what antibodies are proteins that are released by your body to counter a virus. And the reason that we check for antibodies is to see if you've got any immunity to the virus. It's usually done by a simple blood test. I think the government has ordered 3.5 million of these antibody tests, but it hasn't found one that is reliable enough to use. Question 3, taking ibuprofen can worsen this infection. So this all started when the French health minister released a statement saying that taking anti-inflammatory medications like ibuprofen can worsen the symptoms of coronavirus. There's been zero evidence to support this, and both the World Health Organization and NHS England have released statements to say that it's not advisable to discontinue ibuprofen in patients with COVID-19. Now, what I generally tend to do in hospitals anyway is that if there is an alternative to ibuprofen, so usually paracetamol, I'd give that in the first instance, but if there's no contraindications, it would be absolutely fine to give ibuprofen. Question 4, do we have any treatments for COVID-19? So at the moment, when a patient with COVID-19 is being admitted into hospital, it's usually so that we can support them and assist them with their breathing. As of yet, we don't have any known vaccines or treatments for COVID-19. A few treatments have been suggested, and to look into this, a clinical trial called the Recovery Trial is running all across the UK to test out some of these suggested treatments. Now, we don't know if any of them will be effective in aiding a person's recovery, but what's happening is that the data from the trial is being continuously looked at so that if a treatment is found to be effective, it's made available for everyone. Okay, question 5, should I be taking an immune boosting supplement? Well, short answer is these don't exist. There's no such thing as a supplement that boosts your immune system, and a lot of companies unfortunately are taking advantage of the situation to try to market some of their own products. So what I would advise is to look after your health, and you've heard this before, but eat well, exercise, sleep well, and don't engage in bad habits. So habits like smoking can increase your risk of severe consequences from COVID-19 by 2 to 3 folds. so please don't smoke. Okay, so thank you very much for listening till the end of my video. If you have any questions, please message me down below, and this video will be uploaded onto YouTube, so please click on my YouTube channel and subscribe. Thank you.